So, Casey, where are we headed at the moment?
Good morning, David. Well, regional Victoria will be the first in the state to re-experience the freedom, one we've previously all taken as a given, to leave their home for whatever reason they like, with a 14-day average now looking about 4.3. By the sounds of things, that will happen pretty soon. And with Melbourne's numbers today, the 14-day average is now definitely in the 50s. That 56 there is an estimate. It could be a little bit higher or a little bit lower. But if this measure doesn't get below 50 in the next week, something's clearly gone wrong. Hopefully it happens before hump day. The big question, though, is, as for the next step, when will Melbourne get its 14-day average below 5 a day? That's, of course, the million-dollar question, but we do have one Australian data point that shows it can be done. Melbourne's 14-day average is now getting close to the point that New South Wales locally acquired cases peaked back in early April. Obviously, there are some differences between the makeup of the cases in these two waves, but back then it took New South Wales just around about a month to get from the point it was to a 14-day average of below 5. Worth remembering, it only stayed below 5 for about another month, but this month period, that's about the indicative timeline under Daniel Andrews' roadmap at the moment. Now, COVID-19 deaths, meanwhile, are continuing to track downwards, but it's a little bit difficult for us to tell you exactly how quickly, because since this day, we've been learning about deaths that had actually occurred in the days, even weeks prior to that. The Victorian government's at the moment not telling us when all of those deaths actually occurred. So if we just for a second just consider the deaths reported each day that had actually occurred in the prior 24 hours, well then we're getting to see some really small numbers, just over an average of about 3 every day. And David, that's down from a peak of more than 16.